Welcome to Home Care This Week. Definitions. Be a little tricky in a lot of different areas, but in the medical world it's even more important a lot of times to get the right definition correct. One of the things that we see often and get questions often is the definition difference between dementia and Alzheimer's. It can be, a little bit just about semantics, but it's also important to know that difference because there are different forms of dementia. And there are different treatments, and there are things that need to happen differently depending on what that diagnosis is. So it's important to get it right. It's important to get the diagnosis right, as well as that definition. Part of our presentation, or our series of presentations from the Alzheimer's Association, goes into that definition. And here's a little piece or a segment of that presentation that discusses it.
Know what the difference between a dementia and Alzheimer's is. Okay, so it's just a definitional difference, but it does make things confusing if you're not sure. So dementia is the overall term. It's like saying cancer, okay? There are many types of cancer, right? Many different types of cancers that are even treated differently, that are definitely different, but they just kind of under the umbrella of cancer. Dementia is the same thing. Dementia is just a diminishment of your cognitive capabilities, okay? But it can be a result of several different kinds of things, okay? Alzheimer's being one of them, okay? And it is a disease that causes dementia. There are others, Lewy body and frontal temporal, and several other things, including dementia is its actual term, could be things like, bad medication management and alcoholism or whatever. Those are causing dementia. Alzheimer's happens to be by far the most common form of dementia, so that a lot of times it gets equated. And in fact, a lot of the things that we're talking about can be applied to a lot of different forms of dementia. However, it is important to make sure that there is a distinction between them because there are other ones that can be treated and can be addressed, and they all really should be. There are differences, definitely distinct differences. So determining which form of dementia is very important, and so if we know that it's Alzheimer's, then we do things this way. There are a lot of commonalities, but it is important to understand that there's a